Hello, am I audible?
Yes, sir.
Okay. So, good morning, students. Before starting the class, I have to discuss something with you that we observed that some of the students, hello, some of the students are left in between the classes. Okay, and they are not continuing the class during sessions, but they are still submit their attendance form and read feedback form. And some of the students are not attending the classes, but they are get their attendance reports. So from today I am just posting the attendance link or attendance form only into the chat box, not into the Google Classrooms. Google Classroom platform only for note purpose. I'm just submit your class notes into the Google Classrooms, and your link, attendance link, only provided in the chat box only. Okay. And the last count of the participants we have checked, and it is cross-checked with the after submission of the attendance form. Then we are cross-verify that what are the students are not uh, attending in the class, but they are still submitting their attendance form. Okay, so continue the class and get your attendance form or attendance links from the chat box only. I think all of you understands. Okay. So today we have started the remaining part of the executive committee or executive agency. So your last part of executive agency, it is the most valuable and most important for all departments. Those are included in this executive agency. This is called the drug inspector or drug control officers. So this drug control officer or drug inspectors both are selected by the central and state governments both. Depending on the centrally, they are called as a drug control officer, and depending on the state governments, they called as a drug inspector. But both function is similar. So central government and state government first nominated according to their qualifications some of the persons and calling for interview purpose and selected the drawing inspector by a examination process and by a interview process. So this should be happen under the law of Indian Penal Code. So what is Indian Penal Code? Indian Penal Codes, it is called IPC. It is established on the year of 1860. In the Indian Penal Code decided the anything punishment, anything offences, or anything contraventions constituted with any product in under Indian law of governments which is justified by, which is penalty or guilty commented by the Indian Penal Code, IPC 1860. So here you see that it is mentioned as section 21 of Indian Penal Code. So what is section 21? Section 21, it is called as completed authority. It is called as completed authority, means full authority of a government and decided to recruitment every officers, and those officers are empowered by the central governments or the state government and the competence authority while exercising any power or performing any duty under the act means under the act means Drug and Cosmetics Act under the Indian Penal Codes, and shall be derived to be a public servant within the meaning of Section 21. Section 21 describes that those persons are recruited in the post of under the Indian Penal Code by the authority of state government and state government. They give the power or empower provided to those persons. They are called as a public servant, and relevant opportunity is available to work on their fields under the Section 21. Every penal codes have individual sections. In case of when any person done any criminal offense, he should be under any sections. Any persons is going to be murder of any cases, he should be under any Indian sections. So all of this law of authority under the Indian Penal Code. And in that case, when recruitment of a drug inspector or drug control officer, those who are taking the responsibility to control the contraventions and unsafest drugs used in this Indian, so they are under the Section 21 of Indian Penal Codes. Next is the what is the function? They are trying to inspect the license which is linked with the purchase, manufactures of the sales and manufacturing of the drugs. So they are checked the license for the sales of drugs or manufacture of the drugs. Inspect the establishment license for the manufacture of drugs and cosmetics. When any manufacturing industry try to manufacture any types of drugs and cosmetics, this is narcotic or non-narcotic, anything, so he should get the permissions from the Indian government, state government and the central government. So those manufacturing committee, they have give a applications to the government that we have tried to manufacture these types of products. So please give me the authorizations. Please give me the license. So this authorization and license is first applied on the drug control office. Drug control office decided that he is eligible or not eligible for getting license to prepare the manufacture of the drugs and cosmetics. So they sent some drug inspectors to inspect these types of industry or manufacturing farms. The drug inspector is going to those types of drug manufacturing and cosmetic manufacturing farms and inspect that all other facility which is applicable for manufacturing the drugs and cosmetics, they are present or not. If the facility is present, facility means infrastructure of the manufacturing farm, area of the manufacturing farm. Okay, what type of personnel or what type of qualified persons are included in those manufacturing farms. So these types of criteria, when fulfilled by the manufacturing industry, then they are getting the confirmations to the drug inspector or drug control officer that we are eligible to get the license. And then these all types of reports are sent to the drug control office, and drug control officer verify that those things are okay, and this is well recognized by the drug inspectors. So this control office give the authority to or give the license to the manufacturing industry for preparing the drugs and cosmetics. Okay, it is the total rule. Next is the inspectors are required to keep all informations confidential and not disclose it except for official purposes. So those documents are collected from the manufacturing industry before they getting license or after getting license or during the production or manufacturing. When any company, a running company, they are already manufacture these types of drugs and cosmetics for every year. So when the government inspector, drug inspector, going to be analyzed and going to be checked if those are manufactured by these manufacturing industry, it is okay or not. So that time, those legal documents they are collected about the product. So this should be take confidentials on himself and not to be disclosed to any other or any authority. Only disclosed to the drug control officer, only disclosed to the head of the drug control agency. Okay, or only and in case of under the Indian penal codes. So this is the most important things of drug inspectors. If any inspectors take any types of money for getting license to the manufacturing industry, he should be punished or he should be said held guilty under the Indian Penal Code. Okay, and he is liable to fine up to 1,000 or more. Okay, he is liable to fine up to 1,000 or more. Next is the qualifications. What are the qualification is required for appointment of inspectors? Here, you know that the all drug inspectors qualifications, it is mandatory that he should be a pharmacy degree holders. So he has to get a degree in pharmacy or pharmaceutical sciences or medicines with some specialization. There mentions that specialization means two types of drug inspectors they are here mentions. One drug inspector who are taking the samples for testings, and another drug inspector who is the verify the documents. So depending on the when the drug inspector some testing purpose they are taking the samples, they have to gain knowledge about some microbiological issues and the clinical pharmacological issues. So according to pharmacy knowledge, they have to get degree in pharmacy, pharmaceutical sciences, and it is some recommendations from the government that he should be specialized on the clinical pharmacology or microbiology. It is not mandatory, but it is giving the specialization on the pharmacology and microbiology from a recognized or reputed university which is under the Indian law. Next, it is the qualifications. Now we come into the experience purpose. After getting the pharmacy degree, you have to work in manufacturing industry. You have to work in any manufacturing industry which is with those industry preparing the Schedule C type of drugs. What is Schedule C? Schedule C means it is divided in Schedule C and Schedule C1, 2. Schedule C means a list of biologicals and special products. Basically, Schedule C consists some sterilized and microbiological free products like ophthalmic preparations, injectable preparations, parenteral preparations, and some sterile disposable devices. Okay, those import manufactures, sale, and distributions are governed by these special provisions under the Schedule C. So, okay, so Schedule C is manufactured the ophthalmic, parenteral, and the sterile disposable preparations or devices, which is under the Schedule C. So he should be, he must be worked under Schedule C of any manufacturing industry, and he have got a experience not less than 18 months. If your experience is not less than 18 months and he is working under Schedule C, he is eligible for the apply in the post of drug inspectors. Okay. Next is the required not less than 18 months experience in testing at least one of the substance specified in Schedule C of any laboratory under central government or state government and purposed by the licensed authority. He should take 18 months experience, not less than 18 months experience. It is also under the Schedule C. These types of products he has to be tested of anyone under Schedule C. Various types of biologicals and blood products and some sterile preparation is present. So he has to take the testing purpose of any of the product between which is held under the CTOC. Next is the most important. We have gained experience of not less than 3 years in the inspections or manufacturing of any of the substance under Schedule C during the tenure of the services as drug inspectors. Okay. Those persons are already under drug inspector post in a contractual. Tenure means short time service. Tenure means short time service. If any persons uh, have got their jobs and continue less than 5 years, it is called as short tenure. If any person continue his job after 5 years or above 5 years, it is called long tenure jobs. So if any persons have experience in drug inspector and he is already in 3 years in the inspection process, but he is under the contractual short tenure programs, so this drug inspector shall be authorized to inspect the manufacture of substances mentioned in Schedule C. Okay. So he get the permanent jobs in case of inspector positions, and he is already work under the Schedule C in manufacturing cases of the pharmaceutical industries. This is the qualifications of the drug inspectors. Now coming to the what are the duties is performed by the inspectors. Two types of category they are divided to perform their duties. First is the inspections of premises license for sale of drugs, only in case of when they are examine or inspect the sale of drugs. Next come into the inspection of premises license for the manufacture of drugs and cosmetics. First one process, sale of drugs. Here sale of drugs means they are also investigated the cosmetics also. And in case of manufacturing purpose, drug and cosmetics is mandatory. But the first point, the drug inspector get the eligible premises only examine the sale of drugs, but according to the permissions of the government and state governments, central governments, they have also take the authority to examine the sale of the drugs as well as cosmetics. And in case of manufacturing purpose, drug and cosmetics is mandatory. Now one by one come first into the inspection of premises license for the sale of drugs. Every drug inspector should take the authority and responsible for the examine or inspect the sale of drugs. After inspections, if any fault is found during sale of the drugs, so he should give some penalty to the central government. So every inspector have examined or investigated or inspect twice in a year and all premises license for the sale of drugs in his area, and he should satisfy himself that the conditions of the license are being observed. And first in the previous section I said that every company have to uh, go for manufacturing, then he have to apply into the drug control office. So during the sales conditions, everything have a part. Manufacturing purpose, you are getting the license, and when you go to sell any drugs or products, you have to get the license for selling the drugs and cosmetics. So how to selling the drugs and cosmetics? So this is also done by the drug inspectors. Drug inspectors when go for investigations, that all the registers, all the logbooks, and all the area, the selling logbooks, selling varied master plan, selling master plans, all are should be okay, and then uh, drug officers make a report that all things are okay in this area and they are eligible for getting license for selling the drugs. And the drug inspector send this report to the drug control office, and getting the license, and then give the license to the manufacturing area or selling industries. So after getting the license, they are eligible to sell the drugs and cosmetics. Next is coming into the drug analysis chapters. In previous section, I have said that drug analysis is done by the government analyst in a reputed laboratory under the central and state governments. So these samples are taken by the drug inspectors and sent to the government analysis for drug analysis. So how to take? Every drug inspector consists some sampling units or sampling equipments. It is called the probes, probe cells or probe equipments. It is help to sampling those drugs from a bulk vessels or a large amount of vessels after taking the samples. Okay, from the dealers, from the manufacturers, from the delivering boy agency or for the conveying purpose, and directly it is sent to the analysis for drug analysis. And during the sending to the samples into the government analyst, first you have to give some written consentment from the manufacturing personnel who taking authority of these manufacturing units, that what type of sample we give to the drug inspectors, and what is the amount of samples drug inspector sampling from the vessels, and these all pro forma are written in a consent forms, and this consent form is duly signature by the authority of the manufacturing units, and then this consent form gives to the drug inspector, that it is a legal documents that drug inspector is not forced to manufacturer authority to give the samples. He usually give the samples for testing of the drugs for getting license. Next, what is the another function is the investigation purpose of any complaints, written complaints come from any of the man who is working under the manufacturing firms or manufacturing industry to the directly to the government, directly to the drug inspectors. What type of complaints coming? That the man said that yeah, this company manufacturing units dealing with some contradictory things, and they are dealing with some harmful things. They are mixing some harmful things with the active ingredients, excipients, drugs, or cosmetics. So they are giving a written complaint to the directly to the drug inspector, and after getting these complaints, the drug inspector should investigate it into the manufacturing area. With the assistance, he examined the all necessary departments is available in the manufacturing area. Okay, like IPQC, the in-process quality control rooms, IPQA, in-process quality assurance room, production rooms, mixing area, granulations area. Okay, liquid sections if it is available, all vessels he should check. Any trace amounts of harmful agents he should found. So he getting take the authority to cancel the license of the manufacturing industries. So this should be examined on the legal proceedings in case of any breach of act and rules. Breach means against of act and rules. Anything it should be done by the manufacturing industry. It is against of this act and rules. You should get the punishable offense. When authorized by the state government to do so, to detain packages of imported drugs are prohibited it should be imported. During inspections by the drug inspector, he should get found some detained packages. Detained packages means faulty package. Some packages with leakage is there. Okay, some breakage is there in package. Okay, so these types of packages called the detained packages are found during the selling or during the importing. So it should be prohibited during the import. To maintain the all records for inspections, including sampling, and submit copies of such record to the licensing authority. Okay. So after getting the all satisfactory examinations or investigations, and drug inspector himself should satisfied, then he should get a report, prepare a report and these reports is legally by signed by drug inspectors, and all the authorities are involved in this committee, and after signature it is directly sent to the licensing authority. Now come into the inspections of premises license for the manufacture of drugs and cosmetics. So as well as like selling of drugs, manufacturing is most of the important parts of the drugs and cosmetics. So it is also investigated by the drug inspectors twice in a year, okay, with a proper assistance or in a group committees. So all premises they are visited, they are investigated, and they are examined that the manufacturing firms of drug and cosmetics are eligible for getting license or not. And if he is satisfy himself that the conditions of the license are being observed. So under these sections, the C and C1 for the manufacturing, sanitizations, and testing of drugs and cosmetics is done by the help of drug inspectors. Okay. So in previous, I'm said about the Schedule C. So now here another portion is mentioned is Schedule C1. What is C1? Schedule C1, it is also a category of schedule enlisting some important drugs, except those drugs are mentioned in Schedule C. Means Schedule C does not consist biological products, blood products, sterile preparations. Any type of injectable preparation are not included in the Schedule C1. Schedule C1 containing some liver extract like vitamins, antibiotics, other tablet preparations, hormones, in vitro blood grouping serum. Those are import, manufacturing, sale, and distributions are governed by the special provisions under Schedule C1. So during manufacturing, drug inspectors have to investigate it about the Schedule C and Schedule C1, and also get to authority for the standardization and testing of the drug and cosmetics after manufacturing or during manufacturing. Next, coming to the inspections purpose, when it is investigated the locations of the manufacturing industry. What type of locations they are using during manufacturing? It is far away from the populations, or it is nearer to the populations. If it is nearer to the populations, is and they are investigated that what is the sewage systems of the manufacturing industries, and they are investigated about the environment hazard systems, any types of gases or any types of harmful substances which affect the populations or not. Any types of harmful substances are sewage out and directly mixed into the any river or any ponds into the populations, and the populations are infected by that. So many times they are not getting license if their industry are so nearer to the populations. Okay, and they have investigated that they have minimum uh, far away, minimum distance between the industry and a populations. It is a locations purpose, and they are also investigated the constructions purpose. They have investigated the all rooms are all nylon coatings or not, or they are the wall of the industries, it is polished or not, any types of dust particles it is adhering in these constructions purpose or not. Okay, and what is the sewaging systems, what is the pipeline systems. Okay, pipeline systems is coated with a propylene materials or not, like or acrylate polymers are using during the manufacturings of the industry wall. Okay, they are examining these types of construction process. Okay, next is the administrations. Those administrative persons or those persons are included. They are qualified and how much qualified, and this qualification is matched to their prospective works or not. If it is not matched with the prospective work or not, but he have less experience but he's got these types of prospective job, so this time these persons are seized at this moment from the manufacturing industries. And all chemists should be checked, their qualifications should be checked. Individual chemists and individual staffs have different types of files, and they have checked those files individually that this is matched with their qualifications or not. This is all of this under these provisions. Next come into the sampling of the drugs. The sampling of the drugs, it is same as like a sales of the drugs, but this type of sampling is done at the intermediate process one time, and another is the finished sample they have to take. So during taking samples, they have maintained their hygienity, they have getting the knowledge about the microbiology and clinical pharmacology. After taking these samples, they should give a good packaging systems before sending to the analysis. It should be get well packed, well sealed container, put it, and then send to the analysis. Then after during the sending the product to the government analyst, and government analyst after checking give the results to the drug inspectors. Both documents are maintained by the drug inspectors and records in a registers. To send the details reports of each and every inspections to the controlling authority or licensing authorities, and all types of prosecutions in respect of breaches of acts and rules thereunder. So any types of offenses or any types of working is going on which is against these act and rules, they are prosecuted under this act or Indian penal codes. Now come some procedure of inspections. How to inspect drug inspector for each and every department. According to procedure of inspections, they have divided some sections. First section is the for taking the samples of drugs or cosmetics and sent to the analyst. Depending on their parameters, when every any inspectors have samples of drugs or cosmetics, he should intimate the purpose to the person's from whom he takes the samples in prescribed from 17 in writings. From 17, it is a for writing format for when any drug inspectors. This Form 17 is basically prepared by governments or drug control of controlling office. This Form 17 is a consentment form. This consentment or agreement form taken from the authorized persons who are taking the responsibility of the manufacturing industry or manufacturing institute. What happened when drug inspectors going to take the samples and drugs and cosmetics? He should intimate or he should confirm that the persons what under the manufacturing units that he is with the and intimate that the purpose to the persons that he should give the samples from himself to the drug inspectors. And during these sessions, the persons gives a written consentment into the Form 17. In the Form 17, the name of the persons who take the responsibility, what type of samples they are preparing, what type of samples they are sending for testing, analysis. Okay, these all are criteria mentions in this form, and they fill up these mentions criteria and give it to the drug inspectors. Okay, with signatures. After taking the consent form, the inspector should send this receipt for the quantity of drugs taken by him in the prescribed Form 17A. The first form is the 17, which is a written consentment take from the personnel of the manufacturing, and after taking the sample by the drug inspector, if he is taking the 50 gram of samples, okay, from the manufacturing area. So he should give a prescribed or receipt form to the analyst or to the chemist of the manufacturing industries. This form is called the Form 17A. It is for drug inspector purpose. Next, they have divided the samples in four parts. Why it is divided in four parts? Because every samples have different taste according to pharmacopoeia. Means it's a acid testing, it's a as value testing, it's a moisture content test, okay, it's a drug content test. So all things should be done from a one sample. So they have firstly divided the four parts that each and every part going to the individual testing into the laboratory. So they are first divided into the four parts by the persons by a spatula. After four parts, they are taking the four parts in a four individually pouch, and they sealed it well. After sealed it, this pouch is directly transferred into a container. Container is well closed containers, tight container, airtight container. And if these drugs is moisture proof, moisture sensitive, so you have to use the tamper proof packaging materials. Okay, if your drug is light sensitive or thermosensitive, you should store into the amber color contents. So those samples are sent to the government analyst in a sealed packet for testing according to the defined parameters. What are the parameters are defined in this criteria of pharmacopoeia? They have checked those parameters and give the tested results. After the report of analysis or test of analysis has been received from the government analyst, then he is sent to inspectors, and the inspector will decide whether any further action is necessary in the matter or not. If this product is failed for testing, they are not preparing the well and uniform product. So that time they are taking the responsibility to cancel out this product from the manufacturing industry. And this is a large volume of products, and they are already sent into the market without any testing. So he should get cancel the license from the manufacturing industry. So this is all things are depending on the test of analysis. Now come into the for the entry search for all places, persons, vehicles and vessels, etc. They have authority to examine any departments of manufacturing industries. This is the general manager rooms, IPQC rooms, IPQA rooms, quality control rooms, research and development cells. Okay, any types of rooms they have get the authority to visit individually with some manpower or with some assistance. Okay, and they cross verify that this all these area are manufacturers or getting license according to their parameters or norms. So an inspector, if he has a reason to believe that some of the drugs in contraventions of the acts and are stopped by any place, so if any written complaints is come to the inspector that any types of contraventory samples or any type of contravective samples are stored in the manufacturing industry. Contravective means which is harmful, okay, or adulterated products, misbranded products, spurious products. All things are stored, they are manufactured and stored into the industry. If they have getting the information about that, so he should go to visit into the manufacturing industries. After visiting, he may enter each of the place with or reasonable times with a view to search them or verify that what type of products they are manufacturing, and if any contradictory things is they are manufacturing, where they are stored, it is warehouse or in it in the manufacturing area. Okay, so if it is confirmed that he stored these types of contraventory samples or harmful substances, and that time in front of the presence of the all chemist or analyst, they have cancelled these products and get cancelled the license of the manufacturing industries. Okay, the inspectors can stop and search by vehicle suspected to be carrying any drug in contravention of this act. any type of vehicles they are using during the manufacturing of the drugs and cosmetics. If it is contradictory, the same things will be happen with the chemist or with the industries. So this is suspected under the provisions of the Indian uh, Penal Code, Crime Procedure 1898, under the Chapter 4 of the Act, warrant issued by the under sections 98 of the codes. So if it is another sections, if your products is misverified, okay, if your product is mismatched to the mentions criteria, if your product is harmful or contradictory, so it should be under the criminal offense 1898 under the chapter 4. Chapter 4, it is called as a facing guilty to suspect any contradictory things under the provisions. So it should be said the guilty under the chapter 4. And if it is more guilty, so give a warrant issued under the authority names. Those who are preparing these types of products, they are getting warranted issued under the section 98 of the Indian Penal Code. Next is the those types of stocks records are maintained during these manufacturings of these harmful things by the manufacturing industry. All those things has to be or under take the under evidence by the drug inspector of the commissions of an offense and seized by the inspector and take the under custody. All things should be seized by the drug inspector and take the under custody. Next come the last point. It is the prohibitions on manufactures and sale of certain drugs and cosmetics. The inspectors ensure that no person shall himself or by any other persons on his behalf they have maintenance or they have not to do these types of works. First is manufacturing for sale or distributors. If any persons who were those who were involved in the manufacturing industry or behalf of these persons, he try to uh, share or try to manufactures not of a standard quality of drugs, okay, like misbranded, adulterate, or spurious drugs. This is also be prohibited by the drug inspectors. If any cosmetics is not in the standard quality, it is mentioned as a misbranded, adulterate, or spurious, it is also be prohibited by the drug inspectors. Any patent or proprietary medicines, you have an idea about the patent and proprietary medicines. If without any label or prescribed manner, when it is sold or imported or exported after manufacturing, if the patent or proprietary medicine it is not well labeled or no or not well prescribed manner, so it is also prohibited by the drug inspectors. Any drugs which by means of any statements which claims any of such disease or elements happen with these products. So any drugs which by means of any statements which claims any such disease or elements happen with this product. Okay. So this should be also be prohibited by the drug inspectors. Next is the last point. Any cosmetics containing any ingredients which is render unsafe or harmful, it is also be prohibited by the inspectors. In the point B, when any industry try to sell or try to take stock or distribute any drug or cosmetics which has been imported or manufactured in a contravention manner, okay, in a harmful situations or in a harmful category, so this is under the contraventions of the provision of this act, so it should be punishable by the under Act of Criminal Offence 1898, and also warrant issued in the section of 98 by the drug inspectors. Sale or distribute of drugs and cosmetics with maintain the proper conditions and license issued for such purpose under this act. So if they are maintaining the sales or distribution of the drug and cosmetics and proper conditions, so if they have getting the proper license for this product manufacturing and sales of the drugs, and they are not facing any problem from the drug controlling authority or licensing. So this is the total procedure, qualifications, and prospect of inspections by the drug inspectors. So any questions regarding? Any question regarding this class? Hello. Hello.
হ্যালো স্যার।
হ্যাঁ বলো।
স্যার বলছি এই যে স্যার সিডিএল, সিডিটিএল, সিডিএসসিও এই যে স্যার তিনটে যে টার্ম আছে, এই
একটু
তিনটে টার্ম
একটু একবার রিপিট করো।
স্যার সিডিএল, সিডিটিএল আর সিডিএসসিও,
হ্যাঁ,
এই তিনটে যে স্যার টার্ম আছে, এই টার্মের মধ্যে স্যার মানে প্রত্যেকটা ডিফারেন্ট ডিফারেন্ট কি কাজ, ডেফিনেশন আর প্রত্যেকটার সঙ্গে কি রিলেশন, এগুলো স্যার একটু বললে ভালো হয়।
দেখো সিডিএল, সিডিটিএল আর সিডিএসসিও।
হ্যাঁ স্যার।
সিডিএল আর সিডিটিএল ইট ইজ মেনটেন বাই দি সিডিএসসিও। সিডিএসসিও এই টোটাল প্রসেসটাকে মেনটেন করে। ওকে, এবার সিডিএসসির আন্ডারে যখন সিডিএল আসছে অথবা সিডিটিএল আসছে, তাদের ফাংশন হচ্ছে ডিপেন্ডিং অন দ্য সিডিএসসি অথরিটি। সিডিএল বেসিক্যালি ফার্স্ট ফর্ম হয়েছিল ইন কলকাতা। ওকে, সিডিএল ফার্স্ট। কেউ মিউট করো, আনমিউট করে ফেলে দিয়েছে। CDL function and CDTL function most probably একই।
संजना झा।
CDL and CDTL both are under CDSCO, and CDL and CDTL function is more about similar. Okay, but Central Drug Laboratory is first taking the responsibility of the testing of the drugs centrally. Okay, then coming to the CDTL. But some types of products which is not tested by the Central Drug Laboratory. Okay, so these types of products are then goes to into the directly into the CDTL. Okay, so CDL like into the CDL, they are manufacturing or testing like some importance analysis or test of the samples of drugs or cosmetics, which is sent to directly by the custom collectors or courts. Okay, and another function of the CDL that they are carry out such duties which is directly entrusted or by the central governments or the state governments. Okay, and first recognized মানে সিডিএলটা ফার্স্ট রেকগনাইজ করেছিল হচ্ছে ড্রাগ টেকনিক্যাল অ্যাডভাইজারি বোর্ড, ডিটিবি, which is the main part of the CDSC. তো ফার্স্ট যখন সিডিএল তৈরি হলো, সিডিএল এর কাছে যখন প্রোডাক্টস আসতে শুরু করে দিল অ্যাকর্ডিং টু ড্রাগস, অ্যাকর্ডিং টু কসমেটিক্স, সিডিএল এর পক্ষে পুরো প্রোডাক্টটাকে কমপ্লিটলি অ্যানালাইজ, কমপ্লিটলি টেস্ট করা পসিবল হচ্ছিল না। তখন সিডিএল কি করলো, কিছু প্রোডাক্ট রেফার করলো ডাইরেক্টলি টু দ্য সিডিটিএল। শুধু সিডিটিএল নয়, এটা রেফার করলো যেমন সিআরআই, সেন্ট্রাল রিসার্চ ইনস্টিটিউট, কাসুইলি, they referred some veterinary medicines into directly to the Indian Veterinary Research Institute. Okay. So সেন্ট্রাল টেস্টিং ল্যাবরেটরি সিটিএল বিভিন্ন জায়গায় তারা রেফার করে দিল ডিপেন্ডিং অন দ্য প্রোডাক্ট। কারণ সব প্রোডাক্ট সিরিয়ালের পক্ষে অ্যানালাইজ করা বা টেস্ট করা পসিবল নয়। সেই জন্য সিরিয়াল কি করলো আস্তে আস্তে উইথ দ্য হেল্প অফ সিটিএসসিও জাস্ট তারা প্রত্যেকটা পোর্শনকে আলাদা আলাদাভাবে ভাগ করে দিল যে পার্টিকুলার এই ল্যাবরেটরিটা অ্যান্টিবায়োটিক্স অ্যাসে করবে, পার্টিকুলার এই ইন্ডাস্ট্রিটা ভেটেরিনারি প্রোডাক্টের উপর ইভালুয়েট করবে, পার্টিকুলারলি এই প্রোডাক্টটা কোনো বায়োলজিক্যাল ভ্যাকসিনসের উপর কাজ করবে। তো এইভাবে তারা ডিফারেন্ট ভাবে ডিভাইড করে দিল। So this is the main function of the CDL and CDTL under CDSC. Okay.
ওকে স্যার। ওকে স্যার, ওকে।
তোমাদের চ্যাট বক্সে আমি লিংকটা প্রোভাইড করে দিয়েছি, লিংকটা নিয়ে নাও। লাস্ট পার্টিসিপেন্ট হচ্ছে 68, এটাই হচ্ছে কাউন্ট হবে, ঠিক আছে? Okay, today I am ending this process.